When I mention the words drug driving, what does that mean to you?
It means driving that is impaired as a result of the use of a drug. Many drugs affect the brain and the brain function and have to do with alertness and ability to do things like drive a car. This is a major traffic safety problem in the country, and it's been ignored for a long time. And the country, with the help of a lot of people like you and me and a lot of other good people, are trying to understand the problem better and to try to do things to reduce the traffic safety problem. And I might say also, at least in my case, to use the law enforcement as a way of providing a pathway to recovery for people with substance abuse problems. That's the case now with alcohol impaired driving. So that's another positive outcome of dealing with this problem.
Well, and it seems that we're hearing a lot more lately about drug driving. We've obviously been dealing with alcohol and impaired driving through alcohol for decades.
Decades, a century.
And
it's literally a century.
And we still have that problem.
Oh my gosh, we're at the beginning stages now on alcohol, exactly.
But seem to be hearing a lot more lately about drug driving, and obviously alcohol's a drug, and even I understand that. But putting alcohol aside for the moment, why are we hearing more about it now?
Well, we've had a drug epidemic in the world. People don't understand that because many of the drugs like alcohol and marijuana and heroin have been around for a long time. But really, something new in the world happened in the late 1960s and early 70s, where for the first time whole populations were exposed to lots and lots of drugs that are impairing and addicting by very powerful routes of administration, especially smoking, snorting, and injecting, and created a massive modern drug epidemic. This has effects on education, it has effects on the workplace, and of course it has effects in the highway safety. And so we're talking about a particular effect of this modern epidemic, and more recently, of course, the explosion of prescription opiate use has created an epidemic within the epidemic that has received a lot of attention lately, including on the highway.
Well, and I also understand too, and we've been getting a lot more research now, seems like from NHTSA, from ONDCP, or at least the publication of that research, that is also showing just how significant of a problem this really is.
Well, how large it is. Now, that's one of the things that is very, very striking, how many people are involved with drugs, and what a big segment of the problem of highway safety drug driving really is. So I think there's a kind of a drumbeat of publications and media attention, and of course personal stories. The number of people whose lives are affected adversely as a result of this, and deaths, is stunning, and all of that becomes part of a raised national consciousness. And in that context, it's very interesting to me how competitive it is to get into the public space to get attention paid to a problem. And you see that here with the drug issue in highway safety, as it competes for attention with lots of other factors having to do with serious problems also.
Well, and you mentioned fatalities, and I think NHTSA came out with a report that said of those fatalities that are actually tested, 1 in 3 had drugs in their system.
Exactly.
So again, that goes
up dramatically in recent years. Yeah. And a very great concern that the study that I find particularly helpful is from the Maryland Shock Trauma Unit, where for a 6-month period, every driver who was evacuated for very, very serious injuries to the shock trauma unit was tested for drugs and alcohol, and 51% of the drivers had drugs in them compared to 32% who had alcohol. And half of the alcohol also had drugs with it. So that really put an exclamation point. 25% of them had marijuana. It put a very strong exclamation point about the enormity of the problem of drug driving.
Well, and in fact, you mentioned as far as alcohol again, are we really, when we talk about this situation, are we trying to exclude alcohol from drugs here, and if I just fight one or fight for one or the other?
The danger is to get into that a zero-sum game. If you're thinking about drugs, you're not thinking about alcohol, and if you're thinking about alcohol, you're not thinking about drugs. But it's very interesting to me that it's pretty hard to find people who are just drugs or just alcohol. Mm-hmm. There's a tremendous mix going on, and very closely related to each other in every conceivable way now. So it's clearly, and let's take another drug that has a lot of attention, and that's tobacco. When you think about tobacco addiction, well, that isn't a problem on highway safety because alcohol does kill you, but it doesn't impair you from driving.
Well, the alcohol impairs you, but not the cigarettes.
I mean, the cigarettes. The alcohol impairs you from driving, but cigarettes don't.
Right.
And that is so striking. It isn't just the addiction or the use of the substance. It's substances that impair your ability to drive. And alcohol is definitely an impairing drug. And of course, these other drugs we're talking about are major problems. Marijuana, but also many prescription drugs are a problem.